Right. My name is Elizabeth Giovanucci, and I'm a Davenport University nursing student.
My name is Alexandra Carlson, and I am also a Davenport nursing student.
My name is Bridget Ballone, and I'm a Davenport nursing student. And our topic is the do's and don'ts of therapeutic communication.
Why does therapeutic communication matter? Therapeutic communication is crucial to the formation of patient-centered therapeutic relationships. Benefits of therapeutic communication include feeling safer and protected, being more satisfied with the care, increased recovery rates, and improved adherence to treatment. I don't know how to process this news.
I'll stay here and sit with you for a while. Offering self offers presence, interest, and a desire to understand. It's not necessarily offered to get the person to talk or behave in any specific way.
I am hearing voices that are telling me to do things, and it's really concerning.
What do these voices seem to be saying to you? Encouraging description of perception increases the nurse's understanding of the patient's perceptions. Talking about feelings and difficulties lessen the need to act them out inappropriately.
I can't sleep. I stay awake all night.
You're having difficulty sleeping? Restating repeats the main idea expressed. It gives the patient an idea of what has been communicated, and if the message has been misunderstood, the patient can clarify.
What should I do about my husband's affair?
What do you think you should do? Reflecting directs questions, feelings, and ideas back toward the patient. It encourages the patient to accept their feelings and ideas, and it acknowledges the patient's rights to have opinions and make decisions, and encourages them to think of themselves as a capable person. Hi, I'm Bridget. Today, my purpose is going to be a general physical exam. Giving information makes facts the person needs available, supplies knowledge from which decisions can be made or conclusions drawn. For example, the patient needs to know the role of the nurse, the purpose of the nurse-patient relationship, and the time, place, and duration of the meetings. So during the past hour, you and I have discussed your new diagnosis, ways you might need to change your lifestyle, and how to maintain and prevent any further complications. Summarizing brings together important points of the discussion to enhance understanding. It also allows the opportunity to clarify communication so that both the nurse and the patient leave the interview with the same ideas in mind.
Tell me what brings you in today.
I'm here because I just left my husband.
Why did you leave your husband?
There were some conflicts going
How do you
on.
feel about that?
Not great.
No? What are you going to do about it?
I don't know.
No, you don't know how to handle it?
I'm not sure.
Excessive questioning is typically closed-ended questions. It demands information without respect for the patient's readiness to respond, and it may completely shut down the interview and the patient.
So I stopped taking my medications about a month ago.
Why would you stop taking your medications? Asking why questions may imply criticism, and it may come off as judgmental.
I'm really concerned about the surgery that's coming up.
I wouldn't worry about it. I think you'll be alright. Falsely reassuring a patient underrates their feelings and belittles their concerns. You really shouldn't cheat on your exams. Cheating is bad. Giving approval or disapproval may give patient feelings of being overwhelmed, give them low self-esteem, and feelings of being unsure what they are doing in their life. Patients may misinterpret your approval.
Things have been just really rough. My husband has not been treating me well lately.
My advice to you is to leave your husband. Giving advice interferes with patients' ability to make personal decisions. Patients may feel like nurse thinks they're inadequate at making effective decisions. A more therapeutic way to do it would be to give them information to help the patient give an informed decision. There are many barriers to good patient communication. Some examples are a lack of time to communicate due to various demands of a clinical setting, so nurses may be too busy with their tasks during the day to be able to get down into a deep conversation, which brings us to the second one, which is keeping a conversation superficial. Also, being unaware of how to proceed with difficult conversations. Some nurses might not have been taught in nursing school and how to approach a conversation during difficult times. Also, nurses might be prone to change the subject when a patient brings up a difficult topic that they want to discuss just because they don't know how to deal with it. Also, nurses may ignore cues that the patient might be giving just because they may not have been exposed to it, so they may not pick up on it. Also, a lack of confidence in discussing these topics could be a barrier when dealing with these patients. Also, nurses are focused on concrete physical aspects of care. Some nurses view that it's not important to get down into the emotional side. They're more worried about, vital signs and keeping them healthy rather than their emotional state. Also, nurses can get burned out of, how many patients they have, how many tasks that they have in their day-to-day 12-hour shift.
In conclusion, therapeutic communication is an essential aspect of nursing care and the development of therapeutic relationships. Poor communication can negatively impact patient satisfaction, treatment adherence, and overall mental and physical health. See Therapeutic Communication Nursing Handout for additional techniques and reiteration of the do's and don'ts of therapeutic communication.